Bismillahirrahmanirrahim. Very good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh. First of all, I'd like to thank you very much to Brawijaya IVF, who has already inviting me to this very beautiful and wonderful meeting. And I really apologize, cannot be attend to the meeting in person this morning since I have another invitation in Singapore today. Warm welcome also to our good friends, Professor Robert Fisher, who is an expert in IVF. It's really a pleasure for us to having Professor Robert Fisher here in Indonesia, especially in Brawijaya IVF. Also, this is a really pleasure for us in Indonesia that we have a new Brawijaya IVF that already being 1 year open and giving IVF services in our country. So I'd like to continue our discussion this morning with the topics challenge of infertility treatment in Indonesia, the impact, and the unmet need. If we look these figures, the 11 in the rooms, what's the meaning of the 11 in the rooms? This is the big challenge, the big problems that in front of our eyes, but we did not realize that the big problems in front of us. What is the 11 in the rooms? Currently, we are facing a big problem from the climate change, population, demography, that's also closely related to the prosperity, economic, sustainability, fertility, and also family planning. It was 10 years ago when I was in the Newcastle University, Australia, with the Professor Robert Aitken. At the time, he was the Vice Chancellor of University of Newcastle, Australia, and giving us idea to establish Indonesian Medical Education and Research Institute, currently we know as IMERI. Previously, when I was in the Newcastle, Professor Robert Aitken showing me about Hunter Medical Research Institute, the biggest research institute in the Newcastle, Australia, that is belong to the University of Newcastle, Australia. And his paper in 2022 is quite interesting. He told us about the changing tide of human fertility. That is, he emphasized a steep decline in fertility rates in virtually every country on the earth. And then universal decline in fertility is being driven by increasing prosperity, largely through the mediation of social factors. And then very interesting that the most powerful of which are the education of women and an accompanying shift in the life purpose away from procreation. In addition, it is clear that environmental and then lifestyle factors are also having proven impact on the reproductive competence. We can see here the changing the rate of population growth after reaching a peak in 1960. The human population growth continues to decline. And then in the early 1960, population growth rate approximately to 2.1% per year. However, after 1970, and the population growth rate slowed dramatically and now just over 1% per year. What is the total fertility rate? Total fertility rate defined as the total number of the children that will be born to each woman if she were to live to the end of her childbearing years. And until around 1900, world total fertility rate is having constant number of approximately 5.7 children per woman. And then it experienced a gradual decline although it increased after World War II. If you look these ones, the total fertility rate is largely driven by economic and social factors, and then can be readily addressed by changing in policy, sport, and attitude. And also very interesting that environment, lifestyle, and genetic factors potentially result in permanent damage of fecundity. From the paper of Lancet in 2024, also showing us that fertility rate decreased significantly worldwide, and then it will be happen until 2100, that higher percentage of live birth taking place most likely in the lowest income nations, and there will be significant societal and economic effects from these changes. We can see this one globally, total fertility rate was declined. If you look in Southeast Asia, this one is Southeast Asia. Yeah, right now in 2020, most likely the country in our region, the total fertility rate is below the ideal replacement rate 2.1. And we can see here Indonesia, our country, Indonesia, in 1950, the total fertility rate in Indonesia is about 6.0, but right now, the total fertility rate in Indonesia in 2021, it's almost nearly, I think, above 2.0, or even right now is 2.1. And then what happened in 2021, we can see in 2021, it's Indonesia right now is 2.1. And then in the 2100, our total fertility rate even below than 1.5. So it is really dangerous if we talk about the sustainability of population, sustainability of our country. This one we can see the total fertility rate below replacement level. It is increasing across the globe. And then we can see also that natural increase in the birth rate minus the death rate. Negative rate indicates more death in the particular year and locations. So to have total fertility below replacement level with a negative rate of natural, it will be increased until 2100. The paper from Human Reproduction Update also showing us that the total fertility rate is very decline total fertility globally. We can see here in the more developed regions, the total fertility rate is declined significantly. Then in the less developed region, and then the least developed region, and then most likely in the country in the African region, the total fertility rate is approximately between 4 even to 6. So that's why the increase, the high total fertility rate is happen in the least developed country compared to the developed country. What is the nature and cause of decreased fertility? The decrease of total fertility rate is not synonymous with decrease in fecundity. The primary determinant of the short-term total fertility rate are education and socioeconomic factors, and then the long-term declining of total fertility rate influence a combination of environment, lifestyle, and genetic factors. This condition has the potential to result in permanent fecundity disorders. Previously, the Malthusian theory showing us the growing fertility crisis is related to food availability, but right now, food availability has increased, but total fertility rate has fallen. We can see here that developed countries with low total fertility rate even sustain through migration from underdeveloped nations, with motivated by economic security, religious, and political freedom. Immigration is temporary solution to keep population growth at bay. China and India are having also a problem with declining of total fertility rate. Prosperity is the primary reason of fertility decline. Whenever prosperity increases, there's a decrease in family size. The staging is high birth rate and infant mortality. As a prosperity increasing, infant death was declining, parallel to declining of total fertility rate and increasing life expectancy, so it will generate a super age population, most likely in the more developed country. The population aging, more than 20% of the population over 65 is the outcome of the demographic shift, and this has happened including in Japan, Finland, Italy, and Germany. So the global decline in the human fertility, the post-transition trap hypothesis. This is also Professor John Aitken paper in 2021, showing us that economic growth and urbanization also leads to the total fertility rate declining. Total fertility rate have descended below replacement level. So low total fertility rate with rapid depopulation, for example, Eastern European countries. And also, however, low total fertility with growing population also it happened in the big countries such as United States, UK, Australia, Canada, UAE, Germany. It is because of immigration population. What is the cause of declining in human fertility rate? Number one is social factors. This is most impactful in the short term, increasing relying on mechanical and technology advances, growing urbanization, higher living expenses, and better access toward family planning and contraception. Also, it will induce declining of human fertility rate. The second thing is education factors. Increase in female literacy will correlate it with declining in total fertility rate. It has happened because of higher autonomy concerning fertility, associated with peer pressure, confidence, regrets, health, and the presence of support from surrounding people. Having a child is not a priority in life. We can see here adult female literacy increasing, total fertility rate was declining. The third thing in decreasing in marriage rate, the role of male and female are similar nowadays. Relationship built not for marriage. Low marriage rate will induce low total fertility rate, mainly happen in developed country, also affected by increasing rate of birth out of wedlock. You can see here, this is in Netherlands, the replacement rate, the below the replacement rate, the total fertility rate in the Netherlands. The next is environmental and lifestyle factors. High prevalence of global male infertility as a possible acquired causes because of obesity, lifestyle changing, exposure pollution contains synthetic estrogens, these endocrine disruptors such as bisphenol, ethinyl estradiol, and others. Smoking, alcohol consumption, electromagnetic radiation with increasing DNA fragmentation index, psychological stress, sedentary lifestyle, and similar component also influence female fertility that will decreasing endometrial receptivity, increasing embryo implantation disorder, abnormality sexual organ development, and complication pregnancy and fetus. Sperm count has decreased by half in the last 50 years. It has also happened by climate change. We can see here how lifestyle factors affect human fertility. Air population related to increasing sperm DNA fragmentations. And all this lifestyle, environment, endocrine disruptor will declining sperm quality and also increasing the infertility because of changing of the lifestyle and environment, like in electromagnetic radio frequency, the use of mobile phone, computers, high scrotal temperature, drug abuse, and chronic alcohol consumption, bad nutrition, and others. And delayed childbearing and starting a family. Also, this is the not good habit. Aging age more than 35 years old greatly influence human reproduction. Of course, 50% declining fertility potential for the male also will including poor quality spermatozoa for women. Of course, increasing the age will reduction the number and quality of egg cells, often unaware the risk of delayed childbearing due to education and career. The other cause of declining of human fertility because of genetic and IVF industry factors. Genetic factor has big long-term impact, decrease in selection for high fertility genotype, and increasing use of IVF, passing down the low fertility genotype. Even this effect is not significant globally, as the number of births resulting from IVF is still quite limited. We can see here in the Australia how the cycles over 10,000 population was increasing significantly across the years. And this is affordability is a contributing factor toward high access of IVF. Can see if affordability as mean net cost of an IVF cycle per disposable income in percent. If the fresh, this is in the fresh non-donor cycles, you can see this is the affordability, this is the correlation between affordability and utilization of IVF. It means in the countries such as Australia, Belgium, Scandinavian country, because increasing of the income, they will affordability is very high in countries such as Scandinavian country and then Australia and Netherlands. What happened in the China? The effect of gradually lifting the two-child policy on demographic changes in China. You can see there is increasing temporarily of total fertility rate when the China policy market lifted one-child policy to two-child policy. However, this policy led to short-term effect, only short-term effect, increasing the rate of natural increase and the birth rate, but no long-term sustained impact in population increases. This is the conceptual model of infertility prevention based on theory and existing fertility research. Because here we can see how intervention mechanism of actions, primary prevention is very important for us, how lifestyle and behavior changes after protective behavior such as preservation, optimizing when to start relative to family preference, regulating reduction of workplace and the environmental threat. This is the primary prevention. And the secondary prevention, timely help seeking, early detection and access to the treatment. And then tertiary prevention, access to fertility care and reduction in harmful fertility medical practice. And then what is the outcome? Indicator of mechanism of action, increase the fertility awareness and knowledge, aid at the first birth, decrease in exposure to risk and hazard, timely medical help seeking, and then indication of infertility prevalence of population level, time to pregnancy, prevalence of preventable cause, improve access to infertility care, and indicator for quality of life for people with fertility problems, such as endometriosis or PCOS. So I think this is the very good conceptual model for prevention of infertility through fertility awareness and access to care. How was Indonesian data right now? We can see this is in the graph, so the declining of total fertility rate in Indonesia since 1971 until 2020. Right now, total fertility in Indonesia is 2.1 or 2.14, according to our data. However, we can see we are still facing the problem with high prevalence of the marriage rate between 15 to 19 years old. So this is the big problem. We have teen pregnancy because of increasing the high prevalence of marriage in the female below than 19 years old. We can see here the total fertility rate according to the Indonesian province. This is the Indonesian total fertility rate 2.18. We have at least 8 provinces with the total fertility below 2.18. So I think we should be aware, should be very careful. even also there are so many provinces with the high total fertility above 2.1, even above 2.5, such as Papua and East Nusa Tenggara. How about the marriage trends in Indonesia? According to the data, that the marriage trends in Indonesia are declining, and then the divorce trend was increasing. This is also a big problem in Indonesia. And then we can see how the changes in global population structure. In 2045, Indonesia will in the sixth position of the number of population, compare in the 2025 that Indonesia number 4 in the number of population. It means that the total fertility in our country will declining sustainable, will declining continuously. And then if we look this one, how the life expectancy and the total fertility rate in our region. This is our country with the total fertility 2.18, with the life expectancy about 73 years old, compared to Singapore, that the total fertility rate is only 1, China 1.3, Thailand 1.3, and then Brunei 1.8, Vietnam 1.9, I think Myanmar 2.17, and Cambodian, Laos, and Philippines still above us, their total fertility rate. And then the total fertility rate also is quite related with dependency rate. That is comparing the reproductive population, the productive populations compared to the non-productive populations. And then actually the Indonesian dependency rate, the lowest in 2020, is about 44%. And right now, we are in 2024, increasing dependency rate was happened. Why? It is because of increasing the aging population in our country and then declining of total fertility rate. So that's why we should be very, very careful, because Indonesia right now leave the demography, bonus demography in 2020. If we look this one, how dependency rate in across Indonesian province, the lowest in Jakarta is about 39%, and then the highest was in East Nusa Tenggara is 55%. So that's why the strategy to optimize demography bonus is very important, that we should emphasize our population to be more productive, especially in the productive years between 15 years old until 64 years old. This is very important. So we do the planning the family by giving the fertility, the good fertility access. This is also the problem with our country in Indonesia. We have a position 134, the country with highest intelligent quotient. The average only about 79. It is also related with Human Capital Index. Indonesia only ranked 6 in ASEAN, where the problem is still low literacy, quality of education and training, and then also the skilled labor in Indonesia. So that's why the planning of the family is quite important. And then Indonesian demographic dynamics right now here, Indonesian demographic in 2020, 2030, but should be very careful, because increasing aging population will increase, then it will change the Indonesian demography pyramid. And then also the other thing is very important, endocrine disruptors. Yes, many substances will inducing infertility in the world, including Indonesia, such as BPA, dioxin, the bisphenol estrogen, and it will increasing the prenatal androgen excess, the combined influence genetically inherited factors, and embryonic fetal exposure to environmental factors lead to the onset of PCOS in adulthood. And also in the metrosis, the process that we call it epigenetic, and it will happen in the organogenesis period window. So that's why it's very important we studying the family planning and then we should give the quality, increasing the good quality of antenatal care. The changing in epigenetic program, we can see the epigenetic will change the phenotype without changing of the nitrogen base in the DNA. This is the fatal determinant of adult female reproductive health and the disease. The window of susceptibility is very important. If we talk early life exposure to toxic chemical is very related to the reproductive health in the future. This is also impact of climate change in the human health. Systematic review showing us how the climate change is vulnerable and marginalized population, especially in our country, and impact of ambient temperature on ovarian reserve. You can see here how the ovarian reserve will be affected by the climate change right now. How about the 10 years IVF in Indonesia, access to infertility care in developing country? This is our paper just published in 2024, showing us that in the 10 years, almost 70,000 IVF cycles were done in our country, and then most likely our fresh embryo, about the 50,000 cycles, and then frozen embryos about almost 18,000 cycles. And then in 2019, 2020 was declined because of COVID-19 pandemic. And if you look this one, the minimal stimulation data also is still, we did the very few, the minimal cycles in our country compared to the conventional cycle. And then this is the most etiology of the IVF patient underwent IVF in our country's male fertility, followed by multiple factors, tubal factors, unexplained infertility, multiple factors, endometriosis, ovulatory dysfunction, and diminished ovarian reserve. Then we can see the most likely cycle is still coming from the female above 35 years old, is 51%. And then also, if you look this one, the cycles over 41%, 41 years old is about approximately 7%, and then above 42 years old is approximately 5.7%. And then the cycles resulting in the pregnancy, of course, the female below than 35 years old, the success rate is almost 37 years old, followed by 23% success rate if the patient more than 35 years old. And if the patient more than 40 years old, the success rate is about 15%. I think this is the data resulting from almost 40 clinics. And this is the fertilization pregnancy rate. This one we can see here. This is in the patient with below than 35, then the patients above the 35 years old, and then this overall the clinical pregnancy cycle resulting with the clinical pregnancy. And then how about the IVF coverage in our country, Indonesia? Right now, I think the ratio only 55 cycle over 1 million population, so we are left behind by other country in our region. So that's why increasing the fertility access is quite important. If we talk about also the family plan, to starting the good family planning, right now this one is total fertility rate is 2.1, is really dangerous. Then we have several problems in the reproductive health, start increasing the high maternal mortality rate and also high infant mortality rate and high the stunting. And then I think this is the current development, how the people increasing access for fertility care. The fertility preservation right now is well established, and then I think this is the concept how to start a good family planning, starting from adolescence, adult, periconception, and pregnant woman. And it is very important for Indonesia to increasing the human capital development. So the last as a take-home message is, we know that fertility rate decreasing drastically since 1950 until 200 and 2100. Migrations have a significant impact on demographic changes, delayed childbearing, more prone to infertility, increasing prioritization of work and education, also will decreasing the total fertility rate because of decreasing marriage rate. Major cause of human fertility decline, including environment, and also in climate change and lifestyle factors. Also exposure to endocrine disruptor that is mainly happen during embryonic or fetal period. And the cause of decreased sperm parameter are multifactorial. So more than half of population in Asian countries still have below ideal IVF coverage, including Indonesia. And I think this is very important for our country. Total fertility rate 2.18 and dependency ratio now is 44%. So we should establish a good strategy to optimize demographic bonus that can be started since birth. And then palliative future intervention in Indonesia should be personalized in terms of family planning and starting a good family, including also the contraception and fertility access. So 11 in the room means expressions that the important or enormous topic, question, or controversial issue that is really obvious and that everyone knows about, but no one mentioned or want to discuss. So that's why this is very important to our country to solving the problem 11 in the room, including the fertility and also demography. Thank you very much for your kind attention. Thank you.